To make a point, VR is not the therapy. VR is a tool to be used in conjunction with the therapy, and the therapy is standard prolonged exposure therapy. So it's clear to make that distinction, because as a standalone, it's not the therapy.
I see. It's just the tool being used in the therapy.
In the therapy, which is rooted in rigorous psychological research and standard of care. My name is Dr. Paul Greenfield. I am a licensed clinical health psychologist, and I've been practicing here in the North Shore for 33 years. A number of different cases will be referred for VR. Most of the cases are going to experience some sort of specific phobia. The phobias can range anywhere from a fear of driving to a fear of heights to what we call claustrophobia or agoraphobia, an ability to be able to travel distances away from safe places. And then there are the medical phobias, in particular people who have either what we call generalized anxiety about health concerns, but more importantly, people who have specific phobias like needle injection phobias or blood withdrawal and or fear of MRIs, as well as people who have what's called white coat hypertension, where they get anxious in advance of their blood pressure being taken, which artificially elevates their blood pressure. I've been thinking about virtual reality for many years. Going back many years into my practice, I started off treating a lot of people with fear of flying. And in those days, prior to 9/11, we were able to use a behavioral technique called progressive desensitization. And that would be done using imagery, where people would imagine themselves going to an airport, getting on an airplane, taking off, flying, landing, and so forth. But that what we would do is have them develop what's called a systematic desensitization hierarchy, where they would basically rate at different stages along the process their degree of anxiety, and then train them each step along the way to be able to relax themselves. And some people, even despite the best of expectations, had difficulty with imagery, that they just couldn't imagine themselves in those types of situations. So I knew there had to be something better, and VR was obviously the answer that I was looking for. So many years ago, I began to look at what were the possibilities for virtual reality, and going back into the 80s, a company called Virtually Better, which is in Atlanta, in conjunction with a psychologist named Dr. Wiederhold at Emory, developed a program called Braveheart. And Braveheart was, or is, a virtual reality program for PTSD for veterans from the Gulf War. And in effect, what they would do is these soldiers that had PTSD would be presented with a situation in virtual reality that was akin to the actual situation that they were traumatized in. So that they would end up, if they were in their Humvee, with their partner next to them. If it be they were on a highway and an IED went off and there was a sniper on the bridge above, with the use of computer technology, they could recreate that whole scene and then have the person in virtual reality go through that scene again with the expectation that with each repetitive prolonged exposure that they would desensitize themselves from the trauma. They find that the outcome of exposure therapy and VR are actually identical. The difference is that the length of treatment for those patients that are using VR is shorter. So, but the outcome is virtually the same. I would like to see down the future myself getting involved in the use of pain management and getting into the use of some sort of neuromuscular reprogramming.
We believe that our mission as a community media arts center is to provide accessibility to the community around media, technology, and arts. Hi, I'm Kathy Bisbee. I'm the executive director at Brookline Interactive Group, and I'm co-founder and director of the Public VR Lab. Brookline Interactive Group is a community media center here in Brookline, and about 2 years ago we started the Public VR Lab, which is the public virtual reality lab, and we're the first publicly funded virtual reality lab in the country. So we were quite a bit ahead of most other organizations, including universities and governments, and we still are. So we're creating both a local, national, and now international movement to support the accessibility and content creation in the public interest in VR. So really, accessibility in the VR space is something that we're really trying to champion. We've created VR content for the last 2 years. So we started with augmented reality. So we created a project with Marathon Moments. So for the Boston Marathon, we created augmented reality stories that you can actually, all along the marathon route, you can read stories, kind of like Pokemon Go. You can actually check out a story in augmented reality about that particular runner. We also did that last January with the Women's March in DC and in Boston, so people could actually click on, they could actually be walking down the street at the National Mall in Washington, DC, and they could actually read stories, 75 stories about people who had gone to the Women's March. So that was some of the first projects that we started, and then we partnered with the Boston Globe this summer and fall, and we launched 3 immersive stories that we first initially trained their production team, and then created these 3 stories with them at Tufts Medical School, at the dental school there, at the Boston Children's Hospital in their trauma unit, and also at the National Emerging Infectious Diseases Lab, where we did a story about Ebola, including going through the chemical shower with the 360 camera. So we worked with the Boston Globe Stat News team to create these 3 stories, and then we launched them at Hub Week here in Boston and saw about 1,200 people come through our little shipping container that we had set up. We felt that it was really important to make sure that in the new VR space, in the emerging VR AR space, that people had the same accessibility to these tools as they did in the traditional media space. So that's really what initially started it. I think for me personally, what really put it into perspective, I'm a documentary filmmaker, I've been a journalist at different points in my life, and seeing the Clouds Over Sidra, which was a UN project that was about a Syrian refugee girl, I believe in France. Seeing that story in 360 inside of a VR headset was so impactful on me personally that instead of thinking about VR as a game or gaming, I was able to really see the storytelling capacity and the potential of virtual reality. And to me, if we're not bringing the most emerging media tools to our communities, or we're not really doing our job as community media arts centers, so we need to be showing people, here's the next storytelling medium for the future, and here's how we can train you to make sure that you have access to the equipment, to the skills that you need, and that you can create content in the community's interest. we were working on a customized VR experience for the UN Environmental Assembly. And it was a customized experience around global air pollution. So we worked with a developer, DataVise is our partner organization that helped develop on the back end what we needed to create content for the UN. And so we had hundreds of ministers and heads of state just last week in Nairobi come to our booth and be able to show them how VR works through this customized air pollution experience. And then additionally, we showed them a few other experiences, one by Stanford on ocean acidification and another one on just an experience under the ocean. So I think a lot of people have really interesting experiences. A lot of people were amazed that it felt so real, that they really felt that sense of presence that VR only, I think, can provide in storytelling. It's not the same as looking at a flat screen. It's really feeling an embodied cognition as though you're actually present, which has deeper implications on just storytelling and documentary filmmaking in general. If you can make somebody actually feel like what it's like to be that Syrian refugee girl, there's a new tool in your toolkit as a filmmaker and a storyteller. We actually started a virtual reality academy here at the Brookline High School in partnership with the high school about a year and a half ago now. So we started teaching 6 different ways that you can create VR content. And we feel like one of the best ways that young people learn about media literacy is through production, actually. So the more that you produce content as a producer, as an editor, the better you understand what media is out there and what media consumption should be, can be, the pros and cons of it, and so forth. I think that as an educational experience is really incredible to take people out of their current present realities and to be able to place them in a scenario where it's unfamiliar to them is probably one of the best uses for educational VR. But I think there are many, many, many opportunities. I mean, I think that it changes your perspective on things. So I think that power of VR it's so visceral that it has a lot of power in education to show people things they've never seen and to get them to have a different perspective on those things.
There are many other, I think, possibilities that could be down the road in terms of the use of VR, not just for standard behavioral, but for relaxation, for recreation, for really endless possibilities. And we're just tapping the beginning of it.
I think that in 2 years, it's probably going to be really different the way that it looks. I think the technology will change, how we teach it will change. It's very bleeding edge. I think that the consumer adoption has been slower than people would have expected. And so I do think that as we find better ways to create content and better ways for people to experience content, maybe in social VR, but I do think it's going to change how we view our relationship with reality, and I think that's really exciting.